We'll have our next talk by Dr. Haripriya Madam. She is going to talk on how I deal a rotating nucleus of a hypermature cataract when I'm not able to crack. So quite a few times you experience the mixer grinder cataract moving, The whole nucleus goes on rotating into the bag. So how we are going to manage it? We have the expert in the field, and she's Dr. Haripriya, the head of ARAVIND Eye Hospital, Chennai, and the head of the IOL clinics. Most of the ARAVIND surgeons are trained under her and Dr. Meenu when he was with ARAVIND. So they are going to share their experiences. So we have taken all the different types of scenarios, soft cataract, hard cataract, hypermature cataract, and then your techniques of direct chop and stop and chop. So where all you can have difficulties is going to be discussed in this course. No, this is not the presentation.
Yeah. This is not the one. The other one.
Dr. Haripriya Arvind, yeah. This is not the presentation.
Thanks, Dr. Amit. Yeah. So I'll be dealing with how do I deal with the nucleus in a hypermature cataract. I think we all agree that hypermature cataracts are not very easy to phaco. I think SICS is a good and a safe option, but if one does want to do a phacoemulsification, it's important to know certain principles when dealing with this kind of a lens. So the basic reason why the lens become hypermature is because when the cortex degenerates, it becomes hyperosmotic. The fluid is indrawn into the capsular bag, and that is why you find the whole capsule is very tense and the nucleus tends to sink below. It becomes a Morgagnian cataract. And in these cases, the other issue is also the nucleus tends to become very hard. In terms of dealing with these lenses, the first challenge is obviously doing the capsular excess because you have an issue with visualizing the capsule margin. You have the liquefied lens matter, which also can lead to an Argentine flag sign, and the excess can extend to the periphery. The second part is doing the phaco in these very hard lenses. So most of the time you'll find, sometimes you may be a little lucky if the patient hasn't had it for too long, then the nucleus may not be very hard, but most cases this is a very hard nucleus, and what makes it more challenging is that it's an empty capsular bag. So this nucleus is mobile. There's no epinucleus or cortex to support it. And also these zonules are very weak in these patients in hypermature lenses. The capsule is also very friable. So again, a higher chance of a rent. Again, hypermature lenses we see in older individuals who may, to begin with itself, have low endothelial cell count. When doing phaco, one has to be aware of this. So you obviously would have to use stain. You'd also have to use a good viscoelastic. So I would suggest using a soft shell technique here. Using convertin sulfate dispersive viscoelastic at the endothelium will ensure you have protection for the endothelium. And below that, use a high molecular weight viscoelastic, Helon, Provisc, any of these viscoelastics, so that you actually have a good space forming and to keep your anterior lens surface flat. Rhexis forceps is good here because the needle is difficult to do a rhexis because it may extend to the periphery. And again, you don't need to and you should not do a hydrodissection here because you will only make the nucleus, prolapse out into the anterior chamber and things like that, if your rhexis is larger especially. So you would start to go on to your phaco after the rhexis is complete. In terms of setting, I would suggest using a high vacuum and flow. That's when you'll be able to lollipop this nucleus. I typically use a 45-degree tip because I use the balanced tip. But if you want to actually have better occlusion, which is the most important aspect when trying to phaco a hypermature nucleus, is to have good occlusion. So there a lesser bevel tip, like a 15-degree, even a 30-degree would probably work, depends upon the machine you're using. But you also have to have adequate power so you can actually have good cutting and be able to impale the nucleus well. You can retract the sleeve posterior. So if you want to chop, it's important for you to be able to hold deep. So in a regular, hard, in a white cataract, brown cataract, you can trench and then you can actually hold. But in a hypermature lens, the nucleus is so hard, it's difficult for us to trench because the nucleus tends to move. It doesn't stay in place. So you will actually have to go directly and impale. And if you want to impale deep, you will have to retract the sleeve more. So your tip can go and hold on the deeper part of the nucleus, on the lower half. That's when you will have to retract the sleeve, have more of the tip exposed. A vertical chop technique works well. You can do a diagonal chop or even a horizontal chop if it is not very hard, but most lenses, a vertical chop is probably what will work well. For this, I would use a straight chopper with a sharp tip, and I use torsional ultrasound, but if one does use longitudinal ultrasound, then you can pause the ultrasound, use the pulse or the burst mode and different modifications so that this will reduce the chatter. Otherwise, these pieces are so small, the chatter may be quite a bit. So you would want to chop them into very small fragments before you emulsify them to reduce the energy. Okay, this video is not playing. I want to play these two videos from the folder if that's okay.
Anil, come forward. Seats here.
Previous slide. You can go to the folder, the previous slide. I'll do it from the folder if it doesn't work. You can escape. The first one. Yeah, that's good. That's good. Yeah. So this,
Dr. Sinha, you can come in front.
Is a hypermature lens. You can see the capsule is calcified here. You can turn the lights down a little. And the nucleus is quite hard. So, like I said, you will have to use some graspers to complete the rexes here. The capsule can be quite friable. So you don't want to make your rexes too large, just enough for you to do the phaco. So as you're trying, as you can see, this is typical. To get that first hold is the most critical thing. So you'll have to have enough energy. You cannot go with low settings. Use enough ultrasound and impale deep. So you can see that I'm using a new tip. So you can't use a new tip for every case, but at least try to save some freshly or good tips for these hard and hypermature lenses. So you hold deep, retract the sleeve, and your vacuum is high. So I set the vacuum at 550, and you have to ensure that your vacuum, your presetting is actually being utilized. So you will have to continue to hold. So you can see the vacuum is 548, 530, 550. And then if you lose hold, go back, hold again. And then with your non-dominant hand with the chopper, you will gently separate until all the fibers are broken. So this is the Mohan Rajan chopper, 1.75 millimeters. You have it in different depth. It just has a straight line with a sharp tip. And this works well for these lenses, which are very hard. And you may even have to separate it from the periphery to the center, like fiber by fiber sometimes, because you'll find that these fibers are actually quite sticky. So you'll have to gently, because the bag is also weak, so you can't use a lot of force. And I would like to eat them as as it's being chopped. So most cases, I would like to chop completely first and then emulsify the fragment. Sometimes in hypermature lenses, you'll find if you chop first, they may fly in the anterior chamber. So you keep chopping them and then emulsify the fragments. So this is another case, again, a hypermature cataract. In these patients, the vacuum, like I said, I would keep it at around 600. It depends upon what the machine can offer, but it's also what you're actually gaining with your foot pedal. You have to gain almost close to what you preset and continue to hold with that vacuum as you are chopping. So these are microrexis forceps made by Epsilon, no financial interests in any of this. So again, you can see how much the sleeve is retracted. So continue to chop, hold, impale deep, and the vacuum is almost raised up to the preset level, and then place the chopper just ahead of the tip, about a millimeter or so, and go all the way down as you're continuing to hold. So that hold is very critical. And then you chop layer by layer. You separate them from above down. So you kind of ensure you're breaking up all these fibers. So in this case, I am chopping first and then emulsifying. But typically, like I said, hypermature lenses, you can even choose to emulsify as it's being chopped. So I'm making it into 4 pieces first before the fragments are sub-chopped into smaller quadrants. So a good viscoelastic is very critical. Like I said, that's very useful. And the second thing is, at this chop phase, you can use a high power because you're still emulsifying in the capsular bag, so energy is not much of a concern. But as you are emulsifying each of these small fragments, you have to be conscious at which plane it is. It has to be not too close to the cornea, not to the capsule, so something in the iris plane. Make them, small pieces, and then emulsify these fragments. So this can be risky because your capsule is bare, and the chance of a PC rent is high in these patients. So that's the reason why you have to have very good fluidics. You cannot have any flicker, any surge in these patients. And like I said, you want to break them into small pieces, otherwise your chatter will be very high. Because these pieces they don't maneuver as well. So they'll be emulsified. So you want to sub-chop them into smaller fragments. And while you do it at the iris plane, and then take the other fragments from the capsular bag. So if you are, if you ensure that, if any time during your chopping, if you find you're not able to crack completely at one site, I would recommend that you go back and chop again at the same site. Instead of trying to leave that area half cut and going to adjacent site, hold there with your phaco probe, repeat the same maneuver once more, ensure that all the fibers are separated, and then you remove it. Okay, so I think that is probably the concluding part. Is just that you will have to, if you just ensure that all of these factors are taken care of. A lot of effort for your rexes, and then the emulsification. So both of these two have to be done with the right settings, and a lot of patience. So, and in case you do find that you have a rent or something, I think converting is the best thing to do. You don't want to go ahead and continue doing a phaco in a hard lens like this when you have a PC rent. You might want to convert to an SICS. Thank you.
So thank you, ma'am. Very nicely demonstrated the various techniques, and one take-home message: never let ego come inside. What she said is right. If you are not able to chop, don't have a second thought of converting into SICS. We do get very good results with SICS also. So you should be sure when to convert. If you all know that, then you'll never land up in having any complications.